When we talk about HIPAA, guys, a lot of the information related to HIPAA revolves around covered entities. So, before diving into HIPAA compliance and how it works and how to do HIPAA audit, etc., I think it's better to understand what is a covered entity. First of all, let us try to understand what is a covered entity in terms of HIPAA compliance. So, covered entities are, guys, organizations, companies that handle PHI or EPHI during their day to day operational activities. Any business that handles PHI or EPHI during their business operations, day to day operations, is known as covered entities, guys. Okay. So if you are dealing with the PHI or electronic PHI, then you are known as a covered entity in terms of HIPAA. Okay. PHI is protected health information and EPHI is electronic protected health information. If you are not sure about EPHI and PHI, please watch the previous video. So now, what are the different categories under which a covered entity falls, guys? Let us try to understand this. So first of all, a covered entity may fall into number one, it can be a healthcare provider which is dealing with the PHI or EPHI information. It could be a health plan that is being created, or it can be a healthcare clearinghouse. Okay, these are the three different categories which are there. So, healthcare provider can be providers such as doctors, clinics, psychologists, dentists, chiropractors, nursing homes, but only try to see this very important thing, but only if they transmit any information in an electronic form in connection with a transaction for which HSS has adopted a standard. Only then, okay, otherwise not. After that, a health plan can can include, as you are already aware, health insurance companies, HMOs, company health plans. Sometimes organizations also provide health plans, healthcare plans, government programs that pay for healthcare, such as medical, Medicaid, and different types of healthcare programs are there. Also, healthcare clearinghouse. Now, what is a healthcare clearinghouse, guys? This includes entities that process non-standard health information they receive from another entity into a standard electronic format or data content, or vice versa. Okay. So they, in this case, a healthcare clearinghouse receives a you know information, PHI information from another entity. Okay, that's why it comes under compliance in this scenario. So hope you understand the context of a covered entity in terms of HIPAA. It is very very valid to understand covered entity, what it means in terms of HIPAA compliance before diving into the HIPAA compliance itself. So that's why I wanted to create this video. If you have any questions, if you have any follow up doubts, feel free to add in the comment section. Thank you so much for watching, guys. Take care. Bye bye.